Acurx Pharmaceuticals is a publicly held clinical stage biopharmaceutical company that's working specifically on a class of antibiotics for bacterial infections. And with me is CEO David Luci to give me an update, again, give us an update on the company and where you're at. So let's start overall with the company and then we'll dig deeper into exactly everything you're doing.
Sure. So the company has a new class of antibiotics called polymerase 3C inhibitors. And they inhibit the polymerase 3C enzyme, which is the primary catalyst or kind of construction worker that makes DNA for bacterial cells, specifically gram-positive bacterial cells. So like what? C. difficile infection, which is the target of our lead antibiotic, but also Marissa, which is still 52% of all of the hospital-based infections in the U.S. today. So we have two antibiotics currently in the class, the lead of which, ibezapolstat, is in a phase 2b clinical trial right now, treating patients with C. diff, C. difficile infection.
Yeah, and I was telling you how after we did our last interview, I was telling my husband about the interview, and his uncle had C. diff. And I remember his uncle being sick. It was probably 10, 15 years ago.
Yes.
So, it's really very common. And this is, people will get this infection in the hospital or nursing home, correct?
Yes.
Okay. And how common is it, would you say?
There's about estimates are about 29,000 people die every year from C. diff in the U.S., and 500,000 to 600,000 people get C. diff. Mm-hmm. It's definitely life-threatening, and because of that, there's something called the GAIN Act, and the FDA gives us Qualified Infectious Disease Product designation and fast-track status. Mm-hmm. So we have an unbelievable relationship, in my view, with the FDA. With those designations, you really kind of get doted upon by the FDA, and the agency allows you to interact with them as often as you want.
And the current treatments for C. diff are kind of mediocre. Better than nothing,
yes,
but not as effective as you'd like them to be.
No, I mean, our data so far, as limited as it is in terms of patient numbers, we have tremendous cures. Like, I haven't seen any data from any of the antibiotics used to treat C. diff, which is comparable. So vancomycin is 50 to 60 years since their approval, and they cure somewhere around 81% of the patients, depending on which study you look at. But 20 to 40% of the patients have a recurrence of infection within 30 days. It being a life-threatening infection, we think that makes it a vulnerable frontline therapy. And I think that's why Pfizer and Merck both tried but failed to do a vaccine to replace it as frontline therapy. Mm-hmm. So we think in a $1.7 billion market, to have a clear shot at frontline therapy, mm-hmm, for a $40 million market cap company, we're pretty excited.
And the clinical trials look promising that you're doing.
They're really promising. We're analyzing our strategy now, again, with our QIDP and fast track designation. Because the data is so good, we're working with our statisticians to see how we can possibly move forward, mm-hmm, before we get to what we thought would be the end of the study at 64 patients.
Yeah. So say that everything goes according to plan. When do you think this might be available as a treatment?
If everything goes according to plan, it's probably three and a half years away from being available. The drug development cycle is 10 to 12 years, and once our phase 2b trial is done, we haven't guided to exactly when that'll be, but when that's done, all that remains is phase 3 before we can file for approval.
Okay.
And then if our data is really good in the phase 2b, that will actually impact, in a positive way, the discussions with FDA on how big our phase 3 needs to be.
Okay.
So if our data was more like vancomycin or Merck's fidaxomicin, then we might have a lot more patients that we have to treat in phase 3. But if our data continues like it's going now, the phase 3 patient mandate will be minimal.
So let's talk about Marissa too. Explain your treatment for that. Where is that?
So that's at the lead optimization phase of preclinical development. It's a challenging area right now, but we expect to be done with lead optimization by the end of the year. And basically, there's some preclinical toxicity work and manufacturing work for 23. By the end of 23, we would hope to file an IND.
Okay. And you went public in the past year or so, right?
Yep. By the way, an IND is a license to conduct clinical trials in human subjects.
Okay, got it. Okay.
Yeah, we went public in June. we went public in June 2021.
Okay.
Going on to the NASDAQ, of course, like we've done a couple of times in the past.
Yeah.
I know the whole team.
Yeah.
And in July of 22, just a couple of months ago, we did a registered direct offering.
Okay.
We brought in an old friend that I worked with 20 years ago in my first pharma company.
And I know the clinical trials are key, but what else is part of your kind of short-term goals?
So in addition to the clinical trial and the preclinical work on the second antibiotic candidate, we're working on a number of non-dilutive grants, as well as territorial licensing deals, for each drug. Some companies like one, some companies like the other. Really, I think it depends on internal factors at different potential buyers, or licensors. So if they have a hospital-based sales force, they're going to be interested in the second drug, ACX 375. If they already have microbiome programs, they're going to love ibezapolstat, the lead drug, because while we're curing the C. diff, by the end of day 3 of treatment, so far, all of the patients are also fully restored with a healthy microbiome.
Okay. Well, good luck in your trials. I look forward to
Thank you so much.
Seeing how the second phase goes, and then we'll do an updated interview then. Thanks, David.
Excellent. Thank you.
Thank you.
Cheers.